Hi, I'm Dr. Celine Gelgich.
And I'm Dr. Tori Miller.
Welcome to Breaking the Rules.
On Breaking the Rules, we talk about all things OCD.
Obsessive compulsive disorder, OCD, impacts up to 1 to 2% of the population. We are here to provide not just education, but to inspire clinicians, families, and people who are impacted by OCD to be able to access the treatment they need in order to get better.
Catch us every fortnight, wherever you get your podcasts.
Hello, everybody. Welcome back to another episode of the Breaking the Rules podcast. We are joined today by the lovely Clarissa Ong, who is just so prolific in her research on OCD, anxiety, and perfectionism. And she is going to chat to us about all those things, as well as her wonderful book, The Anxious Perfectionist. Welcome to the show, Clarissa. Thank you for joining us.
Yeah, thanks for inviting me.
So tell us a little bit about yourself. What got you into researching anxiety and OCD, and share a little bit with us about your wonderful research, if that's okay with you.
Yeah, of course. I started doing research in college or in university when I was working with Randy Frost, who wrote the foreword for our book, and he does research in hoarding disorder, which is one of the OCD related presentations. And then I went to grad school and worked with Mike Tuig, who's a co-author on the book, The Anxious Perfectionist, and he does research on ACT, acceptance and commitment therapy, and OCD. And so I kind of got more into ACT for hoarding, ACT for OCD, and then I think as I started thinking more about these presentations and thinking about what was maybe similar or common among them, I got more interested in perfectionism as a sort of a more cross-cutting pattern that's less diagnosis specific. And so then I got more into perfectionism, and now my research is sort of focused on more non-diagnosis specific processes and ways to treat those more underlying patterns. So more process-based work is what we would call it, but process means many different
What do you
things.
mean by that? Tell us more.
Yeah. How process means different things.
And what is it you're researching?
So I would say a lot of my research now is focused on process-based therapy and process-based principles. And so by that, I mean focused on processes of change or processes of stuckness, I guess, either way. So kind of broader patterns that are more defined by their effect on the person's life rather than what they look like. So for example, in perfectionism, we think a lot about rigidity with respect to rule following, right? If I have a rule, I should be nice, right? I should always be nice, even if someone's mean to me, or even if I need to stand up for myself, there's this rule of I need to be the nice person, I need to be agreeable. And so that might look like saying yes all the time, or that might look like, not being assertive. So it might look like different things, but the underlying process of I'm following the rule that I need to be nice all the time is constant. So kind of focusing more on those underlying patterns more so, and also focusing on helpful processes of change. So in ACT, we think a lot about psychological flexibility, which is a little broad, but I would say that's a general process of change. So the ability to, when I have this rule or urge popping up that I want to be nice or I should be nice, I'm able to say, does this situation call for being nice or not? And then be flexible and choose accordingly, right? And so that might mean sometimes saying yes, but that might also mean saying no. And so it looks different, but the pattern is we're being more flexible. So kind of focus on that, focusing on individual level functioning. So rather than on a group level, how are people doing, but how is each person doing? Because when we think about the group, we kind of wash away all those very, meaningful individual differences, right? We know everyone's different, but when we flatten everyone to an average, then we just lose some of that, I don't know, complexity. So I mostly do treatment research, and it's thinking about these sort of levels of analysis, I guess.
Oh, sorry, you go, Celine. I could see us both kind of going.
I know, and I had myself on mute. So, that sounds really, really amazing, because a lot of the things that we talk about to our supervisees and people that we work with is what, this concept of what's driving OCD behavior or anxiety or perfectionistic behavior. And we kind of formulate it in terms of form and function. So form being, what do you see? What are the symptoms? And then function sitting underneath that in terms of what's the purpose of this. So it's really lovely that you're gathering research and you're, the data around that, because it gives us language to what's going on and helps us understand some of those processes. It's very, well, I think, correct me if I'm wrong, I think it's rare to see that in the OCD literature as well. Like, a lot of it's ERP based and outcome driven, and a huge focus on reduction of symptoms. And I think now that we're looking at it and understanding it as such a complex layer of layer of complexity, really. Complex layer of complexity. How's that? Then it's really great to be able to gain insight into that. Yeah, I think that's really helpful.
What are some of the, you've spent a long time now looking into OCD. Are there particular things that you found really interesting about OCD and anxiety? What of all the things you've researched, what's really stood out to you?
Oh, that's a really good question. I would say, in terms of research, probably the perfectionism pattern really stands out to me. So I'm doing more research on that. And I think it kind of feeds itself in the sense that the more research I do on it, the more I learn about it, and the more I learn about what I don't know. Like, I think about someone who knows a topic really well knows what they don't know, right? That's sort of how I think about someone who's familiar with the topic. So the more I learn about what I don't know, the more interested I am in it. So I'm sort of in that cycle. That I find perfectionism interesting because it can show up in so many different ways, because it can be associated with so many different symptoms or problems, right? It could look like someone who would meet diagnostic criteria for depression, or someone who would meet diagnostic criteria for OCD or for generalized anxiety disorder or an eating disorder. But it's interesting to me that if we look beneath the surface of symptoms, we might see really familiar patterns. And so when I work with clients with perfectionism, at some point we kind of oh, right, this is that all or nothingness, or oh, this is the rule following, even though their presentations look really different. But on a just non-research level, what if I really like working with clients with OCD, because I find the sort of mental the mental barriers or mental cage of OCD really fascinating. That I think that feeling of I can't do it is so strong, right? I can't not wash my hands, or I can't not arrange this, even though physically is totally possible. But I think the strength of that I have to is so strong. I just find that really fascinating for some reason. And for whatever reason, it just stands out to me more in the context of OCD, even though I'm sure that's true for many different presentations.
Tell us more about perfectionism. Let's go. Celine and I love talking about perfectionism. If we're honest, inspired quite a lot by your work, actually. But
yeah, we're both painful perfectionists.
And we've really started thinking about it and working with our team and our supervisees and talking about it on the podcast about the importance of keeping an eye out for perfectionism and weaving it into the formulation, because it is so influential on a person's presentation and their functioning and as a predictor of outcome. We would love you to just, maybe the starting place is for you to just define perfectionism as you conceptualize it in your work.
Yeah, and I also would be very interested to hear about how you are like conceptualizing it, because I think you can think about it from so many different angles. So, well, I answer first, so it's not like I'm cheating by answer first. So I think of perfectionism really like as at its core as rigidity with respect to rules, and I think that can manifest in lots of different ways, but primarily when we're so rigid with respect to rules, then all the other kind of pieces of perfectionism show up as well. So then I get very distressed when rules cannot be followed, or I get very angry when other people can't follow my rules. Or if I really follow my rules, then I don't really know what I want in life, because all I'm doing is following rules. So I never had a chance to think about what do I want in life. Same thing with identity. Like if I'm just like, this is who I should be, then I've also never had a chance to explore different identities, try on different things that might fit, and then choose which one actually kind of makes me feel most fulfilled. So I think, I think of it really at its core about that, and everything else around it kind of emanates from that. And I think that's probably an oversimplification, but at least for me, it really helps to keep a more kind of focused conceptualization. But then I think you can kind of fit people's specific presentations onto that framework.
Where do you think the perfectionist, I mean, where do these rules come from? So why is it, do you think, that some people end up with such rigidity around rules?
Yeah, that's a good question. I think there are lots of possible determinants. So I think commonly there's a lot of parental expectations, right? So from the time you're really young, this has been sort of like ingrained in you. And I think it's not always conscious. I don't always think it's a parent or parents saying, you need to be perfect, or if you're not good, I'm not going to love you. But I think sort of through implicit messages, right? So for example, if I get a B on a test and my parents are like, oh, that's great. And then whenever I get an A, they're like, ooh, like, you're so amazing. Like, we're so proud of you. Like, it sends an implicit message, like, we like you more when you do better at school, or we like you more when you win your races. So I think there's that. I think there's societal pressure. I think we, like, on average as a society, we really, what's the term I'm looking for? Is it like valorize, or like we really like I think of Steve Jobs as such a quintessential perfectionist, right? Like he's super, I mean, my understanding is he's very mean to everyone. Like he couldn't buy furniture because there's no perfect furniture, like, you know, but I think on average society thinks like, wow, he's such a genius. Like I want to be like Steve Jobs, right? And then there are people who like want to dress like him. But, you know, I don't know him obviously, but I don't know like how his quality of life was. But I imagine if you can't buy furniture for your home, like that's pretty stressful. If your employees, you know, feel like you're pretty mean, that's probably, you know, not, you know, pretty stressful. But then because he's so successful, it's like, well, yeah, he's just a genius. And I think we have a lot of those stories. So I think there's societal pressure. I think usually in our field, there's also a lot of that. I know like therapist perfectionism is a thing. And I think of that too, even when I'm working with my clients, like, oh, I didn't say that right. Or, oh, I should have done that metaphor. That would have been so much better. I always think of good metaphors after session, but not in session. So I think there's that. I think another thing I've been thinking more about too is almost like perfectionism as a form of compensation. So sometimes for people, let's say like I'm thinking like neurodivergent presentations, like let's say ADHD, where perfectionism can feel like a way of like, okay, fine, if I can't, totally pay attention in class, I'm going to record everything and then I'm going to like take my notes really well so that I can make sure I'm like catching up. I think it also provides a sense of control sometimes for people. So I'm thinking people have had a trauma history, that perfectionism, that sense of like, if I just do everything exactly this way, then I'll have control over what happens, can feel comforting in a sense. So I think there are lots of different reasons. And I think that's also part of what makes the presentation like interesting, because it's not always like, my parents, I think parents are really common, to be honest, but it's not always that. Yeah, I'm curious how you talk about in your practice with your supervisees.
I often talk about it as being multifaceted because, especially with clients have sometimes more of a black and white understanding of perfectionism. Like they think of it as it being an aesthetic thing or just order and symmetry, that kind of stuff. Supervisees, depending on level of experience and backgrounds, it's similar, but we absolutely talk about it as a multifaceted beast, really. And touch on a lot of the topics that you'd covered, especially the one where there's you talked about trauma. We cover relational trauma more, where there's family issues with family dynamics and the subtle messages that you talked about. I think that can be reinforcing and really shed a light onto what drives a lot of the perfectionistic behavior and helps with the formulation and gives some aha moments. Because there are so many layers to perfectionism and it can show up in so many different ways. And one thing that stood out for me recently, which I've been really interested in learning a little bit more about and reading a bit more on, is perfectionism that comes out of neglect in early childhood experiences, where the person then overcompensates and kind of goes too far in the other direction. Not only for control, but also for a sense of, not wanting to be like their caregiver that was neglectful, and build a sense of self, but almost it's this overshooting the mark, so to speak, and providing inflexibility and rigidity where it just, takes away from that as well in terms of being able to, I'm kind of now thinking about OCPD type presentations where it creates I guess discord in interpersonal relationships, and is that the word? Am I looking for discord?
Yeah, discord.
Not discourse.
Yeah.
Discord. Yeah. It's 10:30 at night. Discord in interpersonal relationships, and they end up losing out in a sense anyway. So it's kind of like, if I engage in this behavior, I won't be anything like my parent who was neglectful or who was but then the overcompensation, I think, really it's like a double-edged sword. It kind of ends up being unhelpful anyway, I guess is what I'm trying to say.
Yeah. And I'm quite like you, Celine. Like, do you know, Clarissa, it was really surprising to me when you talked about perfectionism. I mean, it surprises me that, when you talked about perfectionism manifesting in things like depression, I get it. And I'm sure that I've kind of thought about it before, but when I define perfectionism, my mind almost immediately goes to the sort of the anxious presentations. And of course that's not true. And I know that, but it's interesting that, you know, to say that out loud, I had to, if I was to define perfectionism, I probably wouldn't have stretched the thread so far. And I probably, like the place that I start is thinking about those, you know, those unrelenting standards and the fear of what will happen if you don't stick to the rules, and that's that sense of just being really uncomfortable and afraid of not measuring up in whatever those standards are and whatever the situation is. But one of the things that I find really interesting that I've now started to, you know, talk about and think about more, which I actually was really, I learned from your book actually, was thinking about perfectionism as being both helpful and unhelpful. Like not thinking about it, I'd always defined it as a really unhelpful beast, like you said before, Celine. And I've, you know, got a long history of perfectionism, which has been incredibly unhelpful. And so for me, you know, it's caused me a huge amount of anxiety in my life, and you know, in areas where like I didn't take risks, and I, you know, have spent ages ruminating on things that are just so meaningless. I think the point at which I realized my perfectionism was quite unhelpful was when I was perseverating on the color of my lipstick that I'd worn to an event, and whether it was or wasn't the right shade to have worn. And I think that was the moment where I kind of went, this is like just reaching the ridiculous. What is this? But I also really respect the value of perfectionism and the drive that it can give. And I really liked the way that in your book you make that distinction about the difference. And I wonder if you could talk to us a little bit about that, because I think that is so important. Well, it has been for me at least, and really influential in my work.
Yeah. It is extremely important. Yeah.
Yeah. So I think about trying to think like which direction to go.
Go all the directions.
I guess like one
Go
piece
all of
is
them.
I guess one piece is thinking about context, right? Like any behavior is helpful or unhelpful, and it depends on context. Even a behavior that we might think, oh, this will never be helpful, in theory, there will be some context where it is helpful.
Even the lipstick thing?
Like, so for example.
Is there some context where
like
it was really important to choose the right lipstick?
So let's say, like, and I mean this like in theory, right? Like if someone was like, you know, I'm gonna kidnap you unless you wear the right lipstick shade, it's like, yeah, you want to ruminate on that in theory.
Yeah.
But I think it's that a lot of times these behaviors are removed from a context where they would be helpful. So for example, I ruminate a lot on conversations that I have with people. I'll probably ruminate about this after. And there's probably some situation where, oh, you know what, I'm doing a podcast in 2 days. So I probably do want to think about what I said now and then think about how, you know, do I want to say things differently? But I don't have a podcast recording in 2 days. So it's probably not going to be very helpful. Maybe it'd be helpful for me, you know, in months if this is relevant again. But certainly not tonight when I'm trying to fall asleep. So I think it's like sort of context dependent. I think also like I think sometimes like there's parts of perfectionism that can feel more egocentric. Like this is sort of like important to me even without fear. There are some elements of perfectionism I still care about. So for example, like, you know, I have to be the best might be more anxiety driven, but I care about my work ethic, or, you know, I care about being able to support other people. Like that side of it is, I think, more values-based, maybe more values consistent. So I think it's almost like if you can find like the elements of the perfectionism, there are much more like this is important to me, and even without fear, this is who I would want to be. And I think those pieces can be helpful to sort of leverage. But I think the anxiety can get in the way, or sometimes I think of it like the rules can sometimes look like a perversion of values, where it's like, you care about other people, so you should always say yes whenever people ask you for help, right? Because you care about people. And, our all or nothing thinking goes like, if you don't say yes, it means you're a bad friend, or it means you're a bad daughter or a bad parent, right? Or like, you care about good work ethics, so you should work till 2 a.m. every day, right? If not, it means like you obviously don't care about your work, right? But then the underlying value of like work ethic or kindness, or, being present for my family, like, I think all of that can still be really meaningful for people.
I think it's a really important distinction to always think about the context as you described, because we can get stuck in those. And you make such a great point in terms of that fusion with our values sometimes can kind of weigh in really heavy, and then we forget about ourselves, don't we? We're other focused, and we forget that self-care in those moments is equally important, and that can lead to things like burnout, and it's this never-ending marathon of chasing perfection, which I think kind of, for me, makes sense, can lead to things like depression and that sort of stuff as well. But coming back to what we were talking about earlier, it kind of brought up a thought for me, and I'm just to hear your thoughts on this as well. Because as Tori said, we see perfectionism as like this doing thing, right? Where it, as an active kind of motivating set of behaviors. But I'm wondering, like, if the standard is set so high, and I can't be bothered achieving that, like I'm not even going to achieve it, so why even bother? Is that what that form of depression looks like? Is what are your thoughts about that?
Yeah, I'm glad you brought that up, because I realized I didn't talk about the sort of other side, which is, I think, and I did the same thing, like I was thinking of that sort of high achieving, like relentless striving form of perfectionism.
Yeah.
But I think the other form, because we have this all or nothing pattern, it's whatever, I'm not going to do anything. So I also sometimes have clients where it's like, in a certain domain of their life, it's like very striving, and another domain, it's I can't be bothered. So for example, a client who, like, it's at the library till closing, like let's say a university student, the library till closing, but then their apartment or dorm room is a total mess. It's like, like leftover food left everywhere. So it seems like someone who works so hard would also have but it's sort of, well, I can't maintain it the way that I would like, so I'm going to give that up. I'm going to focus on work. So I think how like depression might show up, I think one way is that way. It's that it looks like lack of motivation. But I think what's interesting, it's almost like it's like internally, my impression is like people are just spinning their wheels. They're like, should I not? Like, when should I start? And there's actually a lot of stress around it. But from the outside, it looks like, oh, this is such a bad student, or this is such a bad employee. They procrastinate all the time. They can't meet any deadlines. Like, I don't like working with them. But internally, they might have written like 20 drafts, or they might have been sitting for 5 hours not being able to put out any words because no word is good enough or correct. So I think that
sounds painful.
Yeah. So I think that lack of motivation. I think another aspect is that self-worth piece. Right? In depression, we think a lot about guilt and worthlessness, and I think there's a lot of self-criticism in perfectionism. So I think that sense, it could be, have these standards, I know I'm not meeting them, and therefore I'm worthless. Like, what's the point of life if I can't even do something so basic? So I think it can also show up in that way, in terms of depression. And then the ruminations also, I think, usually associated with depression. And I think it could also show up as the sort of lack of interest in things, because if everything needs to be done to a certain standard, I don't think anything will be very fun. I've definitely had clients where they can't even enjoy movies because it's like, if I can't hear every single word, every time I watch a movie, I need to know exactly what's happening. And
That's my husband. He has the subtitles on
Really?
every freaking time. Yes. And then we have to press pause
and go back and
then we have
catch
to
it.
press rewind. Yes, the last few minutes or whatever. And then I'm like, sorry, Clarissa, I cut you off. You've got this beautiful train of thought going. I was like, oh my God, it's him. So he'll hate me for saying this because he gets embarrassed. I'm really sorry. I still love you. Please don't divorce me. So like, if I'm like, our house isn't massive, it's tiny. Our kitchen's like 2 steps from where the TV is, and I'll quickly go and grab something and he'll press pause, bless him, because he's thinking of me, because he doesn't want me to miss it. I'm like, I can still hear it, like, it's cool, I'm okay. And he's like, but what if you can't? I'm like, it's all right, like, context, like, it's good, I appreciate you thinking of me. But now I'm just used to him pressing pause, and now I just was like, now I'm the one saying, let's press pause, I don't want to miss it. Anyway, sorry.
Well, he's not alone, so that helps.
No, that's good to know. Yeah. It's pain. It's like, I think, like, it must be. I don't know if it's painful or not, but it's a thing. Yeah, absolutely.
Yeah, it sounds like it's paralyzing. Like, it makes people get really stuck, unable to move on. It would be it would be really difficult, incredibly difficult. Clarissa, I'm curious, because your book, The Anxious Perfectionism, very much is about acceptance and commitment therapy for sort of anxiety and perfectionism, which certainly very much aligns with the kind of work that Celine and I do. But I'm very curious about your thoughts on ACT versus CBT here, because, I mean, traditionally CBT would have been how we would have, as therapists, would have navigated this, I think. And I suspect is probably still, for a lot of students who are coming out of university, is still what students are being taught, that sort of rudimentary, Socratic questioning, which is a technique that I love, but also a lot of thought challenging. Why did you and Michael lean more towards exploring it at the sort of the intervention for perfectionism from the ACT perspective rather than CBT, or even other methods like schema therapy and things? Like, can you tell us a bit about that?
Yeah. So besides that, we're an ACT lab, so we just have to do ACT all the time. It was because, so if I think of perfectionism as sort of characterized by rigidity, right? The point of ACT is to kind of cultivate psychological flexibility. So in our mind, it's like, like, if ACT is about flexibility and the problem of perfectionism is about inflexibility, that seems like a really good fit. So that's kind of why we were thinking, ACT, let's see what happens if we apply ACT to perfectionism. And in a research context, because I'm sure clinicians have been doing that way before us. So I think that was part of the motivation, and learning more about it, I think it just made more and more sense. So I was, mostly trained in ACT, and so I think my knowledge of CBT is probably lagging behind my knowledge of ACT, and I think you can do CBT very experientially, but I think ACT is sort of almost, I feel like being experiential is so like inherent to ACT, or it's sort of like really important in ACT. And I think that piece I found to be really helpful when working with folks who struggle with perfectionism.
For those who,
because it's
sorry, and I was just going to say, for
ahead.
those who maybe don't know what you mean by that experiential component, can you define that for us and give us some examples?
Yeah, so I think it's I think there's a couple ways I think about it. So one way I think of it is like working with whatever's showing up in session. So rather than like you saying, okay, so when you feel anxiety, like let's talk about how you're going to practice some acceptance work or some willingness, we might catch when when we notice a client's feeling anxiety in session, and it's like, okay, like tell me what's showing up for you. Okay, and then we might even say like, I just like, let's like see if we can notice that without trying to control it, like, notice it like a sunset or like waves crashing on a shore, whatever your chosen kind of metaphor is. So I think that's one aspect. I think another aspect is going for function rather than form. So a really common thing I think of with perfectionism is they'll like do their homework really well, right? And for most clients, you'd be like, oh yes, like, this is great. But with perfectionism, I might go for like the function of that. So the form is great. Like people are doing therapy homework. The form is, oh, I need to please my therapist, or everything I do, I have to do it to the 110%. So I might go after that instead. So maybe that's less experiential, but it's more like, we're thinking about like what is driving the behavior, like you were saying. So I think those are a couple ways, or even when, you can do it with most things. Like, so if a client's like, oh, I don't like, can you explain to me how to do the exercise again? Like, for between session practice, rather than, oh, okay, so when we talk about acceptance, this is what we mean. Sometimes I'll say, yeah, I don't know, like, why don't you try it and then tell me what you find out, kind of thing. So, whereas I wouldn't do that for any, all my clients. So I think that's sort of that experiential thing, rather than engaging on that content level. There's a bit of like, we're just going to work with whatever's coming up.
Using the back and forth, using relationship. Yeah, really dialoguing about things rather than that sort of psychoeducation model where you you teach, you give behavioural instruction, you send them away to do. Yeah.
Yeah, exactly. That's, like teaching by having them do it rather than by telling them how to do it. Yeah, that's a good way of, yeah. Thanks
and
for
so
that.
What does intervention for perfectionism look like?
So I think in ACT, I feel like there are these pretty like basic components or building blocks of ACT, like in terms of the skills that we teach. Like, so in ACT, we teach, acceptance willingness skills, which is like sort of being open to whatever thoughts and feelings show up. There's a diffusion skill, which is like, can I sort of treat thoughts and feelings for what they are, not what they say they are, right? So instead of fear being like, this is scary and, I need to get rid of it, it's, oh, wow, my heart's beating really fast. So sort of being able to see them for what they literally are. There's like values work, which is what's important to you, and so on and so forth. Intervention with ACT, I think, is about thinking about how do I teach these skills in a way that is accessible to the client with perfectionism. And usually experiential work is one way to do it. I've definitely had clients where cognitive restructuring from CBT works really well. So it's, it's not like one way is better than the other. I think it's just, depends on your client. And I think sometimes that experiential style can undercut a lot of the intellectualizing, which is really common. Just like sort of, again, their heads is like, okay, I need to figure it out. And it's the same thing with values. I think I find that aspect really interesting, which is when values sort of get subsumed into perfectionism rather than sort of become an alternative to rules. So it's like, well, I need to know what my correct value is, and then I can start doing valued action, right? Or I need to be like totally ready to engage in my valued action, then I can do valued action. Or like, oh no, I didn't live according to my values. Like, like I'm such a bad person because since I know my values, I should be able to follow them, right? So it can sort of just become part of that pattern even more so.
Yeah, that's very interesting. That idea of the value sort of being integrated into the perfectionism as opposed to being seen as a way to navigate perfectionism. Yeah, that's very interesting. Do you know what's the relationship, do you think, between OCD and perfectionism? How do these two, are they just, is it quite, would you say it's quite common? What has your research told you?
I'm trying to think if we have specific research on that, but I think clinically my impression is there's a lot of overlap, because almost by definition, like OCD is, I have these thoughts that I have to get rid of or neutralize or manage in some way, and I engage in compulsions or rituals to get rid of those thoughts. And I think there's some, I'm not sure if it's specifically in the diagnostic criteria, but there's some implication of rigidity, right? Like I have the thought I have to do the compulsion. I guess you can have a thought without, anyway, that's a separate conversation, because I don't really think that that's possible, but, or a mental compulsion. So I think in the sense of that rigidity, I do think that really looks like perfectionism. But I think, like you're saying, perfectionism is really multifaceted, like to the extent that it affects how we view others, how we view ourselves, how we view the quality of our life, or the behaviors that we've done. So I almost feel like perfectionism is a broader construct. So for example, when we were recruiting people for our clinical study on ACT for Perfectionism, we thought, oh, we're going to get a bunch of people, and then we do a diagnostic interview for research reasons, and we're like, oh, we're going to get a bunch of people who meet criteria for OCD. But the majority of people were people who met criteria for generalized anxiety disorder, or GAD, which is really characterized by worry about lots of different things. And I think that was not expected to me, or at the time, because I was like, oh, I thought for sure this is like an OCD thing, and like, or OCPD. And so I think that's what made me think more about how it shows up in general anxiety and depression. And it's like, oh yeah, I see how it fits there. But
because I could really see how the perfectionism sits underneath generalized anxiety disorder, and that would really drive that rumination. Yeah. What does what's your research said about the efficacy of and the effectiveness of ACT for perfectionism?
So we've done, I think, one randomized clinical trial so far, and the result, I'll be very nuanced about it. So we compared our treatment group to a waitlist control group. So we didn't have a very strong control group, right, as opposed to ACT versus CBT. And we found that on average, people did better in the treatment group relative to the waitlist control group. But that's sort of like a minimum bar, right? It's like people who did nothing and then people who did something. So I think more like rigorous testing is probably needed and I think that's only if we want to see, is this better than CBT? But yeah. And then we also, I think another finding that was important is we noticed, like, again, just in our trial, a rebound effect in valued action. But I don't think as much for the other variables like self-compassion or symptom distress. So it seems like there's something about sort of keeping up that momentum of engaging in values-based action that might have been difficult for some people. Even though like more stable traits like self-compassion, we're sort of still in that sort of post-treatment range. So I think that was another thing that's like helpful to think about clinically. And I can see that just from a therapist perspective, I feel like it's always harder for people. Like they might have, the more like how I see myself might be like once that's shifted might be harder to shift back, but the like keeping up with like daily valued behavior might be harder to do. So I could see that happening
Why do you think that
as
is?
well.
Why is that?
Oh, like specifically, why is valued action like harder to?
Well, because
Yeah,
I guess that makes me curious, because when I think about the implications of that for our intervention, this is something that we are sort of a philosophy that we're trying to teach, that I would hope our clients would be internalizing and then able to take forward outside of just the intervention for their, for their mental health difficulties, but into all aspects of life. But it sounds a little bit like that's actually hard to sustain. And that makes me curious, because that is something for us to watch for or to assist with. Yeah. What do you, do you have any ideas about that?
Yeah. I wonder if there's a bit of the, I wonder if there's some of the all or nothing pattern that kind of shows up a bit. So even if it's not as extreme as at the start of treatment, let's say, there could be some like, oh, I didn't do it this week. So like, or I didn't do it today. Okay, I'll start again next week or something like that. I also think of it for myself, like when I, make new behavioral commitments, or we think about New Year's resolutions, right? It's like, okay, like, yeah, I'm motivated, I'm going to do it. And then it just like kind of tapers off over time. So there's something about, I don't know. I mean, it's a really good question. I feel like if I knew the answer, I could help myself sustain committed action better. But there's something about like, there's like the, oh yes, I'm very motivated at the start. And then life happens, stress happens, and then you kind of, and I think that scale of, okay, like I went off track, how do I get back on track? Probably, I think, now that I think about it, it's probably that's the skill that might be missing. Because it's almost like, oh, sorry.
No, go on.
Oh, I'll just quickly say, I think it's, in therapy, I almost think of it like we're keeping people on track, less so like let them get off track and then teach them how to get back on track. So I wonder if it's that. But yeah, Celine, sorry. Go ahead.
No. Yeah, I can really relate to that with my clients. Like a lot of them have that very pattern of, the session happens, they're motivated for a few days, maybe a week, and then exactly like you said, life happens, and then they fall off the wagon a little bit, and then they, come back in, they get the little boost, and off they go. And I've often wondered if some of that is sorry, I'm distracted by my, I'll cut that. I'll tell the editor to get rid of that. So I wonder if some of that is the elements of perfectionism coming in, as you mentioned before, and setting these standards of treatment needing to look a particular way, or clients needing to do things a certain way. And if I don't do it that way, or, Clarissa explained it to me this way, and I'm not quite sure if I understood her properly, so I'm going to wait till I go back and see her before I do anything. And so the perfectionism turns treatment into a thing, and very much so starts to hamstring treatment, and that's when it can get in the way. And I often say to my clients, I'm like, really, this too? It's going to take this away from you as well. And so we joke about it a little bit, but then also call it out and talk about how much it impacts, and how now treatment is becoming a thing as well, and so, or principles of treatment. And it can be a really really challenging aspect of treatment to overcome. And I almost think there's a really strong fusion with values at that point too. And I wonder, you may have mentioned this, but I wonder if talking about flexibility with values as also being something that we need to talk about with our clients. As much as I love values guided action and live by it, I think we need flexibility there as well. What are your thoughts?
Yeah, I totally agree. I think another pattern with values is, I and this is, I think, a common question among therapists as well, which is, oh, but what if, my client has a family value and a friend value and they conflict or something like that. This idea of like
A value clash.
values clashing or conflicting. And I remember we talked about this in supervision, and I'm pretty sure it was Mike, and he sort of talked about, well, like it seems like a values problem, but this might actually really be more like an acceptance diffusion problem, where it's more about like allowing ourselves that we are not going to meet our values 100% of the time, and that's going to feel uncomfortable, and can we make room for that? And I really kind of liked that conceptualization, that this is actually not a values problem as much. So I think it's the letting go of the rule of I have to, meet my values 100%. And I think part of, human pain and complexity is we will never be able to do all the things we want to do, and we will never be able to be exactly like that person that we want to be. And that's sort of like the paradoxical nature of values, and we still like work towards them even if we'll never meet them. And I think that's really hard for someone who's very outcomes oriented to accept,
and listening to you both, that kind of and thinking about the clinical perspective and the kind of the toing and froing and the coming and going, I guess, that our clients do, it made me also think about, what are our expectations for our clients? I mean, we're talking about perfectionism and their expectations for themselves that they're bringing to us, but I think it's very easy for us to get caught up in our own expectations for ourselves as therapists, and the expectations we then project onto our clients in terms of their progress. And you're so right, Clarissa, in terms of like, what does real life look like, and what does values-led living a life driven by your values look like? And it's not going to look like you making perfect choices every time. And so to a degree, that kind of ebbing and flowing is almost to be expected. How could we do it all the time? And isn't that just part of life? That this is partly why I like ACT-based work, because I love the dilemmas that arise for us as human beings, that offer us an opportunity to just think about ourselves and who we are and what we want to do about it. That it is not about not having the dilemmas. It's about giving us a way to navigate the dilemmas. And so I suppose as therapists, we have to be aware that, we are not setting our clients up to be pursuing perfection as clients in their treatment, because, that doesn't exist.
Mm-hmm. Yeah. And I think, sorry, an alarm's going off out there and I got distracted. Oh my gosh, I forgot what I was going to say. I think another thing, like sort of slightly tangential, I think about with clients with perfectionism is a lot of times, because we have been so focused on the rules, and I say rules, but it could be standards or expectations or, sort of any like sort of thought that is followed rigidly, that when we say like, okay, like what if we let go of the rules, like very often I get a response of, but I don't know what else to do. So then there's this like vacuum where it's like, well, tell me what to do and I'll do it. And then it's sort of like, give me the better rule and then I'll follow that one. And so I think a lot of times there's so much trial and error in, I think, treatment, where it's like, I don't know what that looks like. You don't know, but like, can we be willing to try out different stuff even if we don't know that that is exactly it? And like sort of be sensitive to the feedback that you get when you do try different stuff. But I think that willingness to do something even if you don't know if it's the right thing, I think is a really big part of treatment for perfectionism. And I think that can be really, really tough for people, because it's like, you should know the answer. Just tell me and I'll do it. Like, don't try any like Jedi tricks on me or anything.
I can definitely relate to that.
Yeah. Is that particularly the case for people like for neurodivergence, like where they rely on certain rules and expectations and to get them through?
Oh, I don't have a lot of experience working with well, at least not explicitly that I would know of, but I think like kind of just thinking broadly, I feel like having the rules is okay. I think it's the being flexible around the rules that we want to encourage. So it's okay to have the rule of even something like I need to be successful, but as long as we can treat that rule flexibly and hold it lightly, because it's not the rule itself that's the problem, it's that rigidity around the rule.
Yeah.
So I think we don't want to say, like, kind of earlier Tori was talking about, like, recognizing there are helpful pieces and unhelpful pieces. Like, the rules themselves, they're sort of rules. It's how we interact with them that can create problems. Like, yeah, so like the thought, I am worthless is not unhelpful unless we believe it, kind of thing.
Yeah.
I'm going to pause there for a second. Yeah, I reckon this is really great. I reckon that's a good place for us to start our wrap up. What do you reckon?
Yeah. Sounds good. This has been so enlightening as always. And we just, we could talk about this for days and days and days and days, because there's just so much of it that I can relate to, that I see patterns in my clients that you've talked about, and I'm sure Tori has too, as our listeners would as well. So thank you so much for shedding so much more light on this. There's a lot that we can learn, and for anyone who wants to read more, please follow Clarissa and the amazing work that she does, as well as her colleagues. Before we wrap up, we usually finish up with a couple of questions for our guests, one of which is, would you be willing to share a couple of intrusive thoughts that come up for you, so we can normalize that process in terms of everybody experiences intrusive thoughts?
Yeah, I think for me it's more about, like, how do I pick which ones? I need people to like me is a really big one. So people pleasing is something I really struggle with. Another one is, it's sort of this, like, I need to get this done. So a bad habit, an unhelpful habit I have is, it's the end of my workday, but I'm like, oh, I'm so close to getting it done. So I'll have this, like, you need to finish it. Just get it done. Yeah. And then I end up, end up having a
half an hour later.
Yeah. Or like 2 hours later.
Yeah.
So those are probably two. So I think those are two. Probably.
The other question that we ask all of our guests is whether there's something that they know now that they wish they knew earlier in their life or in their career.
I probably related to my intrusive thought, and I think it's not everyone will like you, and that's just how it is. I think that, especially, like doing, like, so when I do workshops and stuff, like, you get feedback, and I think I always, like, want it to go, quote, perfectly, and it's like, oh, everyone should find this helpful, but no one will. And I think I tend to take it very personally, and I think and so that's something I'm working on. But I think that, like, just, like, not everyone will like all the things that you do, and, like, accepting that is kind of part of the journey. And I think that probably, I wish I had known that sooner. It's something that a lot of my mentors, like, tell me, and it makes a lot of sense now.
Well, thank you so much, Clarissa, for joining us. It has been you've been on our wish list for a while to talk to, and certainly your research and your book has been invaluable to us as clinicians, but also to our colleagues and to the clients that we work with. We're often recommending it. Thank you so much for all the work you do. It makes the work that we do possible. So thank you.
Thank you so much.